What is up, guys, and welcome back to my channel. So today I am going to be doing a 35 weeks pregnancy update. So if that's something you're interested in, stay tuned. Okay, here at my doctor's appointment. Got my belly out, ready to get my the baby heart rate measured. And yeah, that's about it. So today I'm going to be telling you guys pretty much what's been going on at my 35 weeks of pregnancy. I'm doing good. I'm doing good for the most part. The only issue is still the standing for a long period of time, the sitting for a long period of time. Those become very uncomfortable. With sleeping, turning from one side to another side, that's very uncomfortable. It almost feels like I'm out of breath when I'm flipping to the other side or flipping back to the other side. And like trying to find a comfortable position is like really, really hard, because now it's like the stomach is so heavy, like it's putting a lot of pressure on my hip area. Like when I lay down on the side, it's putting a lot of pressure on my hip area that I'm resting on. And although I put a pillow between my legs to that way it doesn't hurt, it still feels super uncomfortable. But nonetheless, baby is almost here, so I only have a few more weeks of this. So I'm just being patient and taking it easy, and yeah, that's pretty much it. I went for my biophysical. Of course, baby did great. He was awake, he was moving around, and we got to see something really cool. Like, this was the first time I saw the baby open its mouth and swallow, and then he stick out his tongue. It was the cutest thing ever. Like, she tried to take a picture of it, but I mean, the ultrasound, the movements are easy to detect, but then the pictures, it's like, if you don't know, if you wasn't there, you can't really tell what the picture was. So yeah, it was so cool to see that, to see the baby swallowing and mouth open, and it was just so cool. I was so happy about that. And then he did great. Remember, he has to get a total of 8 points. He got all his 8 points. He showed signs of closing his hand, his breathing motions, kicking his leg, all these stuff. He did awesome. So I was extremely happy about that. And also I did the non-stress test again. The non-stress test is 20 minutes. They monitor you for 20 minutes. They take your pressure, and they monitor the baby's heart rate. They also monitor the mom. The midwife, she was telling me that I was having contractions, and she asked me if I felt them. I told her, yeah, I feel them. They like the Braxton Hicks. They're not like the painful contractions. I felt the painful contractions, and these are not it. These are definitely the Braxton Hicks, because they just, your belly get really hard and then it goes away. Your belly gets really hard again and then it goes away. So that's how okay, these are not the real thing. The real thing, your belly get hard and it hurts. and then it gets soft, then it gets hard and it hurts. But this doesn't hurt. So yeah. So she gave me a discharge paper, and I'm just going to read it to you guys in case y'all are wondering like what to look forward to if you're pregnant. If you're watching this and you're pregnant and you want to know like what to be concerned about or whatever, I'm just going to go ahead and read this to you guys so y'all could know. So she gave me this paper after I did my test. She said if I'm having frequent regular contractions, which are like 3 to 5 minutes apart, that are increasing in intensity, like painful, then definitely call the doctor or come to the hospital, labor and delivery. If I have broken or leaking bag of water, which is like water just dripping out of your vajayjay and it's not stopping, yeah, that's a sign that your water is broke. You know, you wake up in a pool of water. That's a sign your water is broken if you don't like regularly pee the bed. So if that happens, then you make your way to labor and delivery. If you have bright red vaginal bleeding, and with the vaginal bleeding, she said like if it's like a period, then you definitely have to go to the hospital. But if it's like a little bit of blood with like your mucus, that's actually normal. Like that will happen. So you're looking for blood like period type of blood, that's too much and that's an alarm. Okay, so then you would have to go to the hospital or call your doctor. If you have severe, constant, unexplainable abdominal pain, like especially to the top of your stomach, she pointed to that area, without relief, then definitely go to the hospital. If you having rigid abdomen, like your stomach is like really hard and then it's just not getting soft at all, definitely go to the hospital. If you have a temperature above 101.4 degrees, go to the hospital. If you have rapid pulse, weakness, blurred vision, persistent headache, faintness, decrease of fetal movement, make your way to the hospital. Don't take any chances. And that's pretty much it. So these are some things that I have to watch out for, because baby could come any minute now. So it's like these are some key things that I have to watch out for. So if you're pregnant, these are some things that you should watch out for also. And then she gave me another one here, and it says drink 6 to 8 glasses of water daily. Keep taking your prenatal vitamins, and that's about it. Everything went well, everything went good. I did have my regular doctor's appointment, and at the regular doctor's appointment today, we discussed having the repeat C-section, some of the complications that happen with having the repeat C-section, which is like excess bleeding, your muscle not being able to contract after because of the incision, adhesions when they open your stomach, maybe your bladder is stuck to your uterus, and you know, like stuff like that. So he was pretty much telling me the risk of a repeat C-section, and he was telling me like if I wanted to do a tubal ligation, which means like that's it, I'm done with making babies. But I don't know, you know, I still thinking about it, because I'm like, that's so final, like it's so final, like it's so final. Like what if I can't have another baby? What if I can't? You know, like I just feel like that's so final, and it's like a big decision, and in life anything could happen, and I'm like, I don't know if I want to do something so final. But at the same time, if it poses an extreme risk, definitely I'll be doing it. And this will be the last baby. So, you know, these are some things that we discuss. So that's some things to take into consideration. Everybody's body is different. If he sees that there's an issue with me, then we do it. And if he sees that it's a strong possibility, then we just leave it be. And if we leave it be, that doesn't mean I have to have another child. It's just, you know, an option that's there if I wanted to change my mind, you know, that kind of way. Yeah. So anyways, that's about it for the 35 weeks pregnancy update. I'm about to show you guys my belly bump. Okay, this is my belly bump at 35 weeks. I have on this cute little ruffled dress. At 30 side, that's how we're looking. And that's about it for now. Thank you so much for watching. I'll see you guys in the next video. Be sure to give this video a thumbs up, and if you're not subscribed, go ahead and click that subscribe button. I'll see you guys in the next video. Bye.